Norma Brown works in the Department of Cell Biology and Molecular Medicine at University Medical Dental School of New Jersey in Newark. After years of office work, Norma felt she was having arthritic symptoms in her wrist and shoulder.
The pain I was having was in my fingers. They were stiffening up, and there were sharp pains. It was like you couldn't bend. It was very, very painful. But I was unable to literally lift my arm. And it was very painful. I actually literally had to use my other hand to actually raise my arm.
But Norma didn't go to see the doctor right away. Instead, she tried some home remedies and a wrist brace to alleviate her symptoms.
I went to the drugstore, I got the wristband, put it on and wore it for a while.
After a few months of trying to solve her problem on her own, Norma decided to call her doctor.
When you think about it, it's like, okay, this is not getting better. I need to see what this is and if it's treatable.
So what we've got here is, here's your median.
Ms. Brown was complaining of discomfort in her hands and in her shoulder regions. So apart from a routine history and physical examination that we would always conduct, I also used musculoskeletal ultrasound to help diagnose carpal tunnel syndrome in her case. And also I used musculoskeletal ultrasound to image her shoulders and her rotator cuffs and found that she had some rotator cuff pathology.
He said that we're going to treat this with this system. He said I'm going to use an ultrasound, and we're going to literally see what was going on.
So I'll let you look at your scan right there.
Musculoskeletal ultrasound allows doctors to quickly image a part of the body, diagnose and educate the patients on their condition, and facilitate the immediate treatment of what is causing symptoms. That's what happened in Norma Brown's case. Her doctor was able to diagnose what was wrong, and then with the aid of the ultrasound, treat it too.
In terms of treatment, she wound up requiring injection procedures, so with the use of musculoskeletal ultrasound, I was able to very accurately inject those body regions, and it led to a very good outcome.
He put the ultrasound machine on, showed me exactly and pinpointed where he would do the injection, and he did the injection as he had the ultrasound machine doing the procedure. It was not painful at all. It was a breeze. I think I was more afraid of the actual impact of the needle, and then he said, "It's done."
Much better. And that makes sense because you're doing much better.
Both patients and providers are fans of musculoskeletal ultrasound technology.
I was surprised at the equipment that was being used because I didn't think that that would be the solution to actually looking at a problem of that nature. It was very easy, very comfortable. It was no problem. It was just the experience of just sitting there. He's talking. He basically takes the ultrasound, puts a gel on, and talk you through it. And it's just a breeze. I am able to do the things that I normally had done prior to having the problems. It's totally have changed my activities to the point where it said I'm able to do it freely without pain or strain.